Dear chairs, dear participants, good afternoon, everybody. I will present you family medicine and its effects on nursing in Turkey. I try to draw the framework about family medicine in Turkey. The contents of my speech consist of family medicine as a healthcare systems, family medicine in the world and in the Turkey, and effects of family medicine on the nursing in Turkey. For example, duties of the family health personnel, problems in family medicine, and solution proposals. The main objective of the healthcare systems is to minimize differences in health status between individuals and groups and to optimize health levels as much as possible. Modern healthcare systems aims to offer health services everyone, everywhere and every time. Since the 1990s, World Health Organization has encouraged these systems, giving high-stakes loan to countries applying the family medicine system. Health for All 21 program has identified community and family center primary healthcare services on the 15th target. As you see, family medicine model is applied in many countries in the world. Family medicine model was adopted Turkey in 2004 in order to expand access to basic health care services. And it's located 2 units in the family medicine model. Oh, sorry. The first application was started in Düzce on 2005 and it was introduced in the whole country as of 2010. It's located 2 units in the family medicine model, one of them family health care centers and community health centers. Family health centers individual preventive health services with the first stage diagnosis, treatment and rehabilitation services. And the other one, community health centers, involve the coordination of the social preventive healthcare services. As you see, the services provided by the family healthcare centers: preventive health services, emergency medical services, medical examination, treatment and rehabilitation services, maternal and child health services, outpatient medical and surgical intervention, environmental health, forensic medical offices, oral and dental health services. Family health centers are divided into 4 groups. Group A, B, C, D. And as you see, some standards there is health promotion, broadcast, waiting area, clinic staffs of all of 4 groups. And A, B, C groups, immunization and infant and child follow-up rooms, extra. Electronic order tracking system, monitoring pregnant women and family planning services room, intrauterine devices implementation and follow-up, flexible working, minimum 3 hours per week has Group A and Group B. And examination room at least 14 center, a detect room for intervention for every 3 doctors, active web page, and disabled toilet and nursing room only Group A. I want to show you an example with pictures. Now you see a family center which is Group A. This is a laboratory. In this laboratory, given some services, for example, blood test, hemogram, pregnancy test, urine analysis, fecal occult blood testing, and oral glucose tolerance test. And you see immunization room. Nurses vaccinate babies in this room, and nurses responsible for cold chain, and these services are free in Turkey. Nursing room, baby-friendly institution. These family health centers. The first 6 months exclusively breastfeed is encouraged in these centers. And in this context, the benefits of breast milk and breastfeeding teachings are explained from the period of pregnancy. There are in this room, there are instructive poster and brochure. Family planning room, nurses, midwifery, and family medicine doctors who have intrauterine devices certificate insert the intrauterine devices. And also in this room, smear sample is taken for cervical cancer. Early detection. According to Turkey Health Statistics Yearbook 2014 report, as you see, approximately 7,000 nurses, 13,000 midwifery, and 21,000 doctors are working in family medicine unit. And this report, only 7% of nurses are working at family medicine unit. These rates are very low according to Health for All 21 targets. And family physician, family doctor, and family health nurses is indispensable in a primary health care team. State that 2 members. Nurses working with family physician are one of the main components of family medicine. But in nurse title doesn't locate in the family medicine system in Turkey. This is a problem for us, for nurses profession, because family health personnel title is used for midwives, nurses, and emergency medical technicians in Turkey in family healthcare center. And duties of the family health personnel are as follows: to measure and record vital sign, implement the drug that the family doctor gave instructions, perform wound care services, ensure made available to services, medical instruments, supplies, and devices, and help to polyclinic services to family doctor, and take samples for test, perform a simple laboratory test, and send samples to the relevant laboratory. Give health promotion and preventive services, for example, vaccinate, pregnancy follow-up, babies follow-up, etc. Give maternal and child health and reproductive health services to help family physicians in the delivery of healthcare services at home, but no home visits. To participate in service trainings. Now, I will deal with problems. A number of problems has begun to be felt. Therefore, public health nursing academicians in Turkey have done a workshop on impact of family practice in the public health nursing education and practice. Now, you can see these problems. Family medicine to focus on curative services of family physicians and remain in the background of preventive services. And the lack of team approach, many tasks that are the responsibility of family physicians conducted by the family medicine personnel, not to do a home visit of nurses and midwives, to be not reserved enough space for registration of nursing practice in the family medicine information systems, and nurses, emergency medical technicians and midwives do the same duties. The nurses are working with lack of knowledge and skills related to preventive health services. Nurses are unwilling and unable to take part in the student training, and students don't want to work in a primary care after graduation. And nurses don't participate in training because of work intensity. Family healthcare personnel should be supported participation in the workshop. The majority of nurses in the field don't have a master degree. And it made of wage cuts when family healthcare personnel go on leave, and the salary of the family healthcare personnel varies according to region and performance. There is a salary deduction, a lack of any nursing practice. For example, if the pregnancy will not be deducted, if a pregnancy follow-up isn't done, and if a baby isn't vaccinated, there is a salary deduction. And nurses have a trouble in terms of the physical working condition. Family physicians are trying to reduce costs. For example, materials for health delivery, gloves, clinic materials, and the electricity used for heating, because they make payment. Doctors make payment. And now I will summarize solution highlights at workshop. This solution should investigate the causes of the problems faced by nurses in the field, in the family medicine in Turkey, should start a national project for problems and solves. Nurses should be supported, stretched, and increase their education levels, and family health nursing graduate programs should be open in Turkey especially. Thank you. Thank you for your interest.
The medical technicians, that the nurses, the medical technicians, and the midwives seem to do the same thing? It's a team.
Background, the first doctors, family medicine doctors and nurses, doctors and others.
Right, and others. So the others seem to do the same thing.
Yes.
Right?
Yes.
And regardless of the training. Right? Because the nurses got a different training, the midwives, right, a different training, okay. The technician has a different training.
Not same training.
No, I know that, but they're all working together and doing the same thing? Is that what you're saying?
Yes, okay.
Yeah.
But,
so they're all under the doctor, under the office of the doctor, right? So the doctor is the leader for everything, right?
Yes. Thank you.
There's something you call disabled toilet that I saw there. I didn't understand what that meant in one of the slides. Based on the classifications.
Disabled toilet.
Yeah.
Only group A.
Yeah, what does that mean? Disabled toilet. Yeah, it's based on the groups. Yeah, I'm not sure what it means.
I'm so sorry. I have a little English for this reason. I couldn't do that. Thank you. Okay.
Thank you very much.
Thank you. Thank you. Thank you for your interest.